if you think we have a lot of information out there, we live in an era where we are literally drowning in information. You can go to any search engine and ask any question, and you get articles and blogs and websites and all of this. So we're not short on information. But here's the interesting part and what inspired the book. Despite the information that we have, I continuously felt that patients and families are still confused about basic facts.
Mm,
The information are there, but they are confused about basic facts. Now, why is that? Because the more you have information about things, you could actually have um, signal and noise, and you cannot separate them. Anybody could put anything out there. So it becomes actually very difficult for folks to understand all the information that is out there. So there's so much signal and noise, and we need to separate them. So I thought to myself, why not write a book that is very easy to understand for everyone? And the best way to write something that reaches more people is by telling stories, being a storyteller and sharing stories, and by using plain and simple language. We react as humans to stories much better than lecturing and preaching and textbooking. Because if I tell you a story, I mean, I just told you a story about why I went into cancer care, about the woman I met in 1995, October 1995. I promise you, you're going to remember that story because I just shared a story with you about human interaction and we relate to that. But if I had given you like a big lecture about the importance of science and cancer care, what I got into it, you will forget that in about 2, 3 days, maybe less. So I wanted to bring the art of storytelling with plain and simple language, combine both, and come up with something that everybody can read. And these are all true stories. Every story in the book was a true story of a patient or a family member or a neighbor or a friend that I have taken care of. So whenever you read it, you're going to imagine yourself a character in the story and you can really relate to it. Through these stories, I bring the scientific points and the information. So if I talk about staging cancer, I tell you several stories that I actually went through and that shaped how I started thinking about simplifying the staging for cancer and so on. And lastly, I wanted to use the continuous journey of what happens from diagnosis until hopefully cure. So I put myself in the patient's shoes and I went step by step what happens usually, and hopefully this will become a simple guide for anyone who wants to read it. Doesn't have to be patients. This could be family member, a nurse, a student, a pharmacist, a doctor, anyone who is interested in understanding the cancer journey in a very simple way will see something that will draw them into the book.
absolutely. I don't know if there is a chapter around genetics, but obviously the growth of genetic and genomic information and its implications in how we treat cancer and how cancer is being studied is it seems to be growing faster than our ability to implement it right into the healthcare system. And I know this is kind of a loaded question. In fact, we could talk all this podcast about this,
Of
but
course.
but when you think about like the emerging genetic insights and kind of how this is improving our diagnosis, improving treatment, even recovery and prevention of cancer, like what stands out to you that is actionable now that some of the patients who or their family members who are looking might be interested in?
Yeah, I mean, genetics and cancer is really the name of the game, and I do talk about this. So the last chapter in the book called "The Future of Cancer Care,"
Mm,
and I talk about various aspects where I think the future of cancer care will be a bit different, including the use of genomics and genetics when it comes to diagnosing cancer and treating cancer. Also, throughout the book, when I talk about immunotherapy, targeted therapy, and things like that, it's hard to do that without alluding to the genomics and cancer. And pretty much what's happening right now today, the ability to understand cancer on the molecular level has transformed how we actually target and treat cancer and how we really even think of cancer. Because now we have the capabilities of of understanding the disease on a very deep level. Let me simplify it. I think your listeners will know I like to simplify things. It's almost you're looking at a building, and you know it's a building. So think of the cancer as a building. That's all what we knew about the cancer. It's a building, and we just need to actually destroy that building. So we just throw rocks at it, and these rocks are various types of chemotherapies and so on. Well, today we know the details of inside the building. We know the rooms of the building. We know the detail of every room. We know the how it's decorated. We know what's happening, the colors of the walls. We know the floors. So you have the details of what's happening inside. And you also know how you erected that building and how you built it. So you have the ability, you start understanding the dynamics that led that building to be what it is. So instead of just throwing rocks at it, and because when you throw rocks at a building and the building destroys, you actually have a lot of damage to the surrounding people, right? You have a lot of collateral damage because everything's going to be destroyed. Well, now you actually become more methodical into how you attack that building. So, well, I'm just go in. The problem in this building is not the whole building. Maybe there's like this one room that is really to take care of it, and so on. So that's how I view genomes and cancer. Right now, we have the technology of actually sequencing tumors and understanding the DNA architecture, the RNA architecture, the protein architecture of these tumors. And once you actually know that, you can, number one, develop drugs that target these. Number two, if you already have drugs that can target these, you can use these drugs. Why use the rocks if you can use a very more targeted treatment that doesn't cause a lot of damage to healthy people and healthy tissue? So I think that's the present and the future. Frankly, it's about knowing more targets and then being smart in designing treatments against these targets. That's what it is. Because sometimes you find these targets and there are no treatments for them. So it's good to find them, but if there's no treatment for it, then you have to research and try to develop a particular drug that goes against that target if you keep seeing it.